I work in the field of vehicle safety. I'm an industrial engineer and also a medical emergency specialist with a great deal of experience in rescue work, especially in traffic accidents. As an engineer, I know the physics involved in an accident occurring, and as a healthcare professional, I have experienced the tragedy lurking behind these accidents. Rescuing the injured in a traffic accident is chaotic, and a great deal of time is wasted due to the lack of means and as a result of space being so limited inside the vehicles. Active vehicle safety prevents accidents, and passive safety protects the occupants in the event of a crash. But it's necessary to move beyond these two types of safety. To lessen the consequences of highway accidents, it's necessary to facilitate rescuing the injured so that they will get to hospital as soon as possible. This is what is known as post-crash safety. The following comparison is self-evident. Ships are always equipped with lifeboats. Buildings are equipped with fire hoses available for firemen to use. So why don't we provide anything in vehicles for the people who are going to rescue us to use if we have an accident? If we provide this for them, they will work better, they will work faster, and they will rescue us faster, most obviously. The most critical aspect when rescuing someone is to immobilize their head, neck, spine in proper alignment so as to prevent or keep them worsening a spinal cord injury. After several years of researching and prototypes, I've developed the eRescue system for providing a solution to this problem. Starting from standard equipment, the vehicle seats have been digitized to optimize their design virtually. The eRescue system integrates into these vehicle seats everything that is necessary for immobilizing the injured, removing them from the vehicle and facilitating their transfer to hospital. The seat back serves as a rigid structure for immobilizing proper head, neck, spine alignments. It is therefore sufficing to immobilize the person on the seat and remove the entire seat so as to have the best rescue system at hand straight away. Located underneath the seats are a neck brace, an immobilization harness, and an actuating mechanism for releasing the seat anchoring system to free the seat for removal. The eRescue prototypes were optimized to the point of having become a commercial product now available on the market, and this system was put to the test in a simulated major bus crash rescue trial in which the currently used means of rescue and the eRescue system were compared. This trial was funded via the European Commission Funds for Innovation. During the trial, 2 rescue operations were performed on the same bus and were carried out by the same rescue teams, with the invaluable aid of Madrid's Medical Emergency Service and the San Sebastián de los Reyes Civil Defense Unit. Also important was the collaboration of the Emarquil vehicle seat manufacturer and the ALSA bus transportation company. The one and only difference between these 2 rescue procedures was the means used for immobilizing and evacuating the injured. In the rescue trial using the current means, the rescue teams were provided with everything necessary. This was an idealized situation because material is lacking on any actual accident scene, thus meaning a rescue time of longer than 2 hours. However, for the scientific purpose of comparing these 2 systems, This factor involving the lack of material was eliminated. Under these idealized conditions, the process of immobilizing and removing the injured took 1 hour 20 minutes. This rescue time far exceeds the golden hour, the critical length of time for maximizing the injured person's likelihood of survival. Despite having all of the necessary material at hand, the narrow width of the bus prevented them from working properly. On the contrary, in the rescue trial using the e-rescue system, the rescue material was at hand on the spot, as would likewise be the actual case in a real accident. To make matters a bit more difficult, the rescue personnel was not familiar with the system and learned to handle it during the rescue process, the outcome being an overwhelming success, it having been possible to completely evacuate all of the occupants on the bus, immobilizing them perfectly well in solely 30 minutes. All of the healthcare personnel having taken part having agreed that, with some practice, this time could be cut closer to 25 minutes. This means an average of 2 patients evacuated every minute under optimum conditions for preventing spinal cord injuries. This means that all of the patients can be treated and transferred to hospital within the golden hour. And since time is critically of the essence for the survival of the injured, the e-rescue system is unquestionably capable of minimizing the consequences of traffic accidents. Speaking of the e-rescue system's potential, this system is slated to be implemented on buses shortly, and work is currently being done on getting this system installed in automobiles. Every year, more than 1,300,000 people die in traffic accidents worldwide, and more than 40 million are severely injured. The potential of e-rescue, the post-crash system we have developed, is that of reducing this tragedy by half. This meaning saving the lives of more than 500,000 people every year and preventing the resulting severe after effects of traffic accident injuries for another 20 million people. The e-rescue system comes to complete the full circle of motor vehicle safety because it's the only way of lessening the consequences of inevitable traffic accidents, which is what we're working to achieve.